Hey guys, Dr. Kalantari here. Just wanted to, well, first represent my Chiefs on the big upcoming showdown against the Denver Broncos. Go Chiefs. But today I wanted to talk about veneers. A lot of people come in and they have heard about veneers. They, are wondering about veneers, and whether it's a right solution to kind of achieve their Hollywood smile. And the short answer is sometimes, right? I always like to start out by saying veneers aren't for everyone, right? And so that's where, having that conversation with your dentist and truly breaking down the options makes the most sense, right? And that's something that I always want to do and like to do with my patients so that they know what their options are. But some of those options, to give you an example of what those options are, sometimes if the teeth are perfect, if they're beautiful teeth, they just need to be a little straighter. Sometimes all we talk about or all that needs to happen is a little bit of orthodontics, Invisalign or traditional ortho, something like 6 month smiles. That's a little bit of a quicker procedure just to get the teeth in the right spot. And then bleach them afterwards and they look perfect. Other times a little bit of bonding might be necessary. Veneers are really great for people that have misshapen teeth, that have severe staining discoloration that just can't lighten with bleach, or someone that just wants a completely different profile, if you will, of their teeth, and that's something that we may not be able to accomplish with just bonding per se. In that case, or in those cases, then veneers are great. Now, I will say sometimes we do them all together, right? So there's cases that sometimes a couple teeth might need some veneers, but straightening the teeth out and maybe doing a little bonding on a few of the other teeth might get the final result we need without going and veneering every tooth in the smile, or 6 or 8 veneers or 10 veneers. So it's really custom when it comes to the patient, and that's something that obviously is very important to talk to your dentist about, so that what all those options are, because it's easy to just go all in and assume we're just going to veneer 10 teeth, but really is that, if that's not the best thing for the tooth or the teeth, the smile in general, that's not what we want to do, right? So I think the most important thing when it comes to veneers is kind of understanding what a veneer is. A veneer is different from a crown. A crown covers the whole tooth. It's usually used to rebuild up lost tooth structure, whether it be from a cavity or a fracture or something like that. I'm not going to necessarily crown a tooth just for aesthetics or cosmetics. I think a veneer can usually accomplish that. It used to be that we would crown teeth, or dentists would crown teeth because of worry about veneers staying on. And, I know a lot of patients come in with that concern. And thankfully, we've come a long ways in terms of our bonding protocols and the strength of those adhesives, as well as the physical bond that the material, the veneer can actually have to the tooth. That I'd say, as long as it's, properly done and run with the correct protocols, that it's certainly something that is well maintained, and not something that you have to worry about constantly popping off. So I tend to kind of dissuade patients from worrying about that too much. The main thing that I think is always the main conversation that needs to happen is that the best treatment, right? Is that what's necessary? And if it is, then veneers are amazing. I mean, it's cool to kind of see the befores and afters, and kind of the life-changing smile that we can obtain. But sometimes it's definitely not one size fits all, and something that needs to be thoroughly planned out properly, so that you can achieve the best result. Because in the end, if a veneer does involve a minimal amount of preparation on the tooth, but it is still preparation on the tooth, right? So in my eyes, if I'm changing anything permanently, meaning the tooth, taking away tooth structure, then it needs to be done correctly and as conservatively as possible. So anyways, that's kind of a generalized breakdown of veneers and different options when it comes to kind of creating a prettier, more Hollywood smile, if you will. If you guys have any questions, by all means reach out on social media or check out our blog post on our website. And of course, if that's something that you're interested in, whether myself or your dentist, ask those questions. Find out what your options are, because I think most people can have that beautiful smile. It's just a matter of doing it the right way. So I hope you guys have a wonderful day, and talk to you soon.